Good afternoon, everyone. I'm Bea Harris. I'm the publisher of the Denver Urban Spectrum. And it's lunchtime for some people, depending on where you're checking in with us from. So thank you all for joining us today for this very informative and educational presentation and Q&A. This is our Urban Spectrum Now segment for November with Dr. Lane Rolling. You'll hear a little bit more about him in a moment, but before he is introduced, I just want to say thank God the election is over, and I hope you all, and I hope everyone I hope you're all as happy as we are here at the Denver Urban Spectrum at the election of President-elect and Vice President-elect Joe Biden and Kamala Harris. Our next issue will focus on this historic occasion, so please check it out either online or if you're in the Denver area, please pick up a copy. And if you're not in the Denver area, if you would like one, you can email us and we will make sure that you get a printed copy. But as you know, they will be taking on this out of control pandemic of COVID-19, which is reaching, I guess, about 240,000 right now across the country and growing. So it's a big concern for us, and especially as the African-American community. But we are blessed that we have someone in our midst serving our communities who has answers to your questions that you won't hear on TV. His mission is to help save lives and help you learn ways to keep you, your family, your home, your business safe, and a way to live during these next several months and the next several years, actually. So he is here to answer your questions truthfully with facts. We've also started a monthly column called Rolling with the Doc. So if your questions are not answered here today, you can also send those questions to editor@urbanspectrum.net, and we look forward to having those answered hopefully in our next issue. Right now, I'd like to introduce the current editor of the Denver Urban Spectrum. It's Alfonso Porter.
Well, thank you very much, Bea, and good afternoon, everyone, and thank you for joining us today. As we reach the 9th month of sequestration, most Americans are becoming obviously frustrated, desperate, with a high level of anxiety. The virus that was supposed to infect just a few people, according to our president, and that would simply and magically go away, has claimed now nearly 250,000 American lives and has now surpassed 10 million infections around the nation. That is 1 in 32 Americans infected with this virus. There is no sign of it slowing down, and as a matter of fact, the rate of infection has dramatically increased to more than 120,000 cases per day, with approximately 1,000 deaths every single day in this nation. Hospitalizations have reached an all-time high. Cities around the nation are forced to create field hospitals, the kinds used in war zones. They are forced to bring in refrigerated trucks to contain the bodies of the dead. This against the backdrop of an administration that has simply thrown its hands up in defeat, leaving the entire nation vulnerable to this deadly disease. Unfortunately, the news is even worse for the Black community, with people of color experiencing a higher rate of COVID-19 than any other ethnic group in America. Virologist, trauma surgeon, and chief medical officer of SRS Inc, Dr. Lane Rolling, is offering ways to return to work and school more safely. Dr. Rolling, a certified chemical and biological warfare expert who is dedicated to saving lives and eradicating the coronavirus, is making an urgent call for change by speaking truth to power. His mission is driven by his passion to change today's COVID-19 statistics to create a brighter tomorrow. Often called the Black Dr. Fauci, Dr. Rolling's grassroots efforts include traveling across the country and appearing in virtual town halls and meetings to speak and educate organizations and businesses about COVID-19 and how they can protect themselves from the impending second and third wave of this virus. As director of TPA IDA, Clinical Field Medicine Bioresearch International, he conducted research in tropical disease and infectious diseases for approximately 14 years in Peru and worked extensively with native Peruvian shamans to find new drugs. Dr. Rowling became the Chief Medical Officer of SRS, which stands for Systems Ready Solutions, Inc., a Tennessee-based minority-owned corporation providing disaster response services in June. Rowling is helping the company develop several services and products that could integrate into protocols for eliminating the risk of COVID-19 when opening facilities to large numbers of people. Welcome, Dr. Rowling.
Hey, good afternoon. Thank you for the warm welcome, Alfonso. I appreciate it and stuff. And I look forward to giving folks some new information and some timely information.
Thank you. Why don't you bring us up to date with your activities over the last month or so since we've had an opportunity to speak?
Oh, thank you for that question. Just been exciting times, a lot of traveling, a lot of educational, a lot of implementation of the technology that SRS has brought to the world to save people's lives. I've been on MSNBC News. I've been on the Black News Channel several times. I've been in the Black News Press, Zoom calls and town halls from Jacksonville, Florida to North Carolina to LA, across this vast country of ours, trying to save people's lives and really, truly in the trenches and being a field soldier, trying to make a difference in people's lives.
Now, how is your message being received?
Absolutely fantastic. I think people are more stunned because of the information, because of the misinformation that people receive from the top of this government, and what we've done at SRS, and as the Chief Medical Officer, with Charles Pickett, our CEO, our thing is to make sure that everything that we do and what I say have always been based off of science and medicine. Like I've said before, if you understand the science, you must know the medicine. For you to understand the medicine, you have to know the science. And that's the reality of what we do. And what my experience in biological warfare and doing real world clinics in the jungles of the Amazon, you can imagine jumping out of a boat into a swamp with leeches and snakes and humping 9 hours into a jungle to get to a village to treat an epidemic of dengue or malaria or rabies outbreak. It gives me a different perspective based off of real world experience and not somebody drinking a cup of coffee in Chicago.
That sounds harrowing. Listen, you mentioned the amount of misinformation that we're receiving, and obviously we can't turn on any broadcast, radio, television, or even log on without somebody talking to us about COVID-19. So can you tell us about the misinformation? What information are you referring to when you say the misinformation that we're receiving?
Well, the misinformation is how we got to this point back in March and stuff. And I'm going to elaborate for about 3 or 4 minutes and try to give people a context of what I'm trying to articulate to people. As a virologist and a professor of pathogen virology in Heinrich Institute in Germany, I understand virology. I understand infectious diseases. I did my fellowship in infectious diseases in Peru, over 6,000 hours dealing with infectious diseases. The problem that we had at the beginning, where you had people that are not scientists jumping into an area of science, especially virology, infectious diseases. And what they've done, they've killed a lot of Americans, up to 250,000 now. And, when you think about the death rate, that is more people that died in Vietnam, in Korea, and jumping into World War II. By March of next year, more people are going to have died from the SARS-CoV virus than all the wars from World War I, World War II, Korea, Vietnam, and you can throw Iraq, Afghanistan, and our real world missions now. So this misinformation and not understanding the science. What I tell people is that you have to understand and break it down to people, all people, to understand at a level that it to people. And that's what we've done here at SRS and what I have articulated from the beginning. When I had my first interview, when I came back to the States March 3rd from Peru, my daughter was like any other millennium. She was scared. Her friends were scared. So she says, you know what, Dad, I want to do a podcast with my daddy, who's one of the top infectious diseases and trauma surgeons I know of. And people didn't know about that. And I broke it down to her to give her the information that all her friends needed to survive. And so when we say misinformation, one, this virus is no more deadly than influenza. That's a lie. 37,000 people die every year from influenza. We're up to 260,000 here in American deaths. And this is going to be half a million, probably by December 31st, probably 1 million by March. Even if we do get a vaccine, this virus is already out the box. So that's one misinformation. The virus is going to go away because of the weather. This virus does not follow the normal dogma of influenza, i.e., influenza is usually October, November, December, January. This virus, the SARS-CoV virus, which is a beta coronavirus, is here in all seasons, spring, fall, winter, etc. It is not going anywhere. And this virus is more lethal than HIV. It's more lethal than Ebola. It is much, 3 times more lethal than influenza. And so this is some of the misinformation. And what I'm telling you, Alfonso, and to the audience that we're listening to, you hear Fauci, you hear these people get on there and they start throwing these big words out on Fox, CNN, and MSNBC talking about community spread of the virus. Well, so I had a Zoom call last night with Southern Illinois and the NAACP of the state of Illinois. And I said, what we need, and they said, Dr. Rowland, if you get put on the Biden COVID healthcare task force, well, I'm already on the congressional Black COVID healthcare task force, congressional. What would you do differently? Well, it's not about community spread of the virus. It's community education, ground roots, going to each community, having town halls and giving people the real information that makes sense.
Yeah, that's fantastic, Dr. Rowling. And listen, we are hearing now, just over the last couple of days or so, this magnificent news about an impending vaccine. And in our last conversation, you warned us a bit about the vaccines coming too soon, whether we can trust the efficacy of it. Can you talk a little bit about that, and how worried should we be? How confident should we be in this impending vaccine that we're hearing about? Well,
and this break it down to all the people out there in the world, because this, folks, is when we talk about this SARS-CoV virus, there's nothing have never seen in our society in thousands of years. You look at the Spanish influenza in 1917 to 1920, which really started in 1912 and went on for 10 years in China. This particular disease itself is going to go on until 2029. So everybody's looking for this miracle vaccination that's going to change the world. Well, folks, in my opinion, based off of science and immunology and clinical immunology and teaching this stuff, the odds of this shot being effective or this vaccine being effective is not very good. And the reason why I say that, when we look at influenza, which is an RNA virus also, it's 25% effective. That's what the CDC says. But it's really probably 15% effective. So the other 85% of the people that take that shot don't get any effect on it. So you can imagine the SARS-CoV virus, which is a beta coronavirus, which is the largest RNA virus on the planet. I mean, has immunogenic capabilities. It's very effective in infecting cells in your eyeballs, your nose, your throat, your kidneys, your gastrointestinal tract, your vessels in your brain, coronary arteries, etc., found in your testicles. It can go transmitted transplacental from the mother to the fetus. Folks, this virus is different. This virus in 1 year since last year has had over 12,000 mutations in its genetic pattern. But the most important genetic mutation that it's had is the 7,000 mutations that have happened in the receptor gene, or the spike protein that allows it to attach to cells, your eyeballs, your nose. That is the most important key on this. And this thing is changing all the time. So you say, Dr. Rowland, what are the chances they come up with a vaccine? I told you they were going to come up with a vaccine. The question is going to be, how effective is that vaccine? And in my opinion, folks, I want everybody to understand, I'm not here to scare people. I'm here to save people's lives. And you have to have factual, scientific information. They can roll out a vaccine. Well, guess what, folks? more than likely that vaccine is not going to be very effective because the spike protein is always changing. This virus mutates every 2 weeks. Now, let me explain to everybody out there. When you talk about viral epidemics or pandemics, this virus jumped from an animal, a bat, into a man. That's how it usually goes. When we have outbreaks, bats, animals, their viruses jump into human beings and we have diseases. Ebola, dengue, I can go on, rabies, etc. Always an influenza from pigs. Well, when you look at this virus itself, now what's happening, folks, and this is brilliant. The virus has jumped from a bat into man. Then the virus has jumped from man into an animal called a mink in Europe, and also minks here in the United States. And then the virus has jumped from the mink back into the human being, and the virus is different. The virus mutated. So when you start talking about having a vaccine, you have to have every possible combination on the planet to be effective. And if there is one kid in the jungles of Peru or Africa, Cameroon, Europe, somebody in Oregon that refuses to take the vaccine, you will never, ever get complete inoculation of the society, because that person will always be the ground zero to potential infection. So you have to inoculate everybody on the planet, and that is almost not going to happen.
My God. Okay, and so you say 12,000 mutations.
In one year.
What does it take in order to address something? Yeah, well, I mean, so what is it going to take in order to address something that is mutating at a level that large?
When we think about vaccinations and we understand clinical immunology, and you understand diseases, the most deadliest viruses on the planet are not DNA viruses, they're RNA viruses. And when I want everybody out there to understand that there's two genetic materials, we have DNA and we have RNA. Well, DNA is much more stable. When you talk about lethality, the most effective viruses that affect human beings and kills people and causes lots of consequences or side effects or what we call morbidity are RNA viruses. The reason why is that RNA viruses are always mutating. They're genetic freaks themselves. So i.e., there is no vaccine for Ebola. There's no vaccine for dengue or chikungunya or Zika, a really effective vaccine for influenza, because the virus is always changing. And this virus, the coronavirus, is part of that family of the RNA virus that changes all the time. So this is the reality based off of science and medicine.
So as you speak about inoculation, then can you explain to us how that's possible, given the fact that this thing is mutating at such a level? So what can we be inoculated with, and can you explain how that whole thing would work?
Well, when we talk about clinical immunology and also vaccination, there's a word that everybody should write down and look up themselves. And immunology is a word we call affinity maturation. Let me repeat that word again, affinity maturation. What does that mean? Well, folks, when you get infected by a disease, your body, your T cells, your B cells, your immune system, or what we call your cellular mediated immunity, recognizes that foreign organism, viruses or bacteria, and it makes antibodies to it. And your body remembers that. So the next time you get infected, immune response, you make antibodies, it neutralizes a virus or kills the bacteria, and the infection go away. Well, folks, you can look it up yourself. When it comes to coronavirus themselves, we're talking about the normal cold, because we've all been exposed to coronavirus. There's 4 of them circulating in the world. It's the second leading cause of the common cold worldwide. Guess what, folks? This is a SARS-CoV virus. There is no affinity maturation. What does that mean? Well, I get infected with the virus, i.e., I get they come up with a vaccine for it. They inject you. Well, guess what, folks? You can be infected again. People have gotten the SARS-CoV virus the first time. People have gotten it again the second time, and people can get it again the third time, which means there is no conferred immunity. which means you have immunity lifelong. Immunity with coronavirus is very short-lived. You get the infection, you get the inoculation, you might have immunity for 30 days, 60 days, but it's not been proven that you have long-term immunity for this virus. That's why it's very important for people to understand that the vaccine is not a solution to end all solution. It's going to come down to people having great biosafety, biosecurity protocols, being able to test themselves, making sure their buildings and their homes are SARS-CoV free, and that they need to understand this is the new norm that they're working in.
Give it to us straight, Doc. This thing that they're talking about that should be available here within the next month or so, and they're touting it at 90% effective, whatever that's supposed to mean. Give it to us straight. Is that something, particularly for African Americans, is that something we should seriously consider taking?
I'm gonna put it this way, folks, and I'm gonna base it off of science and medicine. I mean, we can look at the history of the United States. You know, my responsibility to save people's lives. If I thought it was the best thing in the world, trust me, I'll be the first one up and getting that shot. I understand malaria medication. I understand remdesivir and HIV patients because I've treated these patients. I've seen these patients in real life and not based off a textbook. The reality, folks, is that I'm going to wait for at least a year to 2 years to get the science behind it. Why? Well, when we start talking about a system injecting people with vaccines, we can use the Tuskegee syphilis experiment about what the government has done to people, injecting Black folks, socially disadvantaged people with syphilis, and studied them for 40 years. They didn't inject other people, they injected socially disadvantaged people. Operation Warp Speed, 1950, the polio, came up with a polio vaccine and they jumped it on our society. 20-something thousand people died and people were put in iron lungs. Operation Warp Speed. Swine flu, 70s. Once again, rushed it, people got sick and died. So if you get this vaccination and you get sick and die, who are you going to sue? Who's going to answer the question? And my first question is that if somebody's touting the vaccination, I want to see the white paper. I want them to inject their grandchildren, their mothers, their fathers, because they have that much confidence in it. And I want to see what's going to happen over a year or 2 years. You need to study it based off the science and stuff. That's the reality.
Yeah, we know what this government will do because we know what this government has done. But in the meanwhile, what is your advice to us? I mean, should we just continue as we have over the past 9 months, sequestration, social distance, washing your hands, etc.? I mean, so what should we do? And I think a lot of people, and certainly need to hear your advice, but a lot of people, particularly African Americans, will rush out thinking that the government has the answer and get the injection. And so if you're saying to us, be mindful of what has been done in the past, what's the answer for us?
Well, the answer is like what I said earlier. You know, people talk about these folks, Dr. Bree and all these people get on television. They're talking about community spread of the virus and stuff from some office a million miles away. These folks are not on the ground. I call it a community educational spread is what we need to do. Folks like me, what I'm doing, SRS, we're in the field, one person at a time, one community at a time. And so I want all the audience out there to get a piece of paper and take these notes that I'm about to give you, because this is going to save your life. And the reason why I say that, because in the world of infectious diseases, we have ways that viruses or bacteria are transmitted. And if you understand how a disease is transmitted or a virus is transmitted, then you can protect yourself, your family members, you can work pretty good. I've dealt with multi-drug resistant patients that have tuberculosis that will kill you. I've dealt with Ebola. I've dealt with people with dengue and malaria and HIV and all these pathogens, and I haven't been affected because I understand how diseases are transmitted. So folks, here we go, because this is a community sit back, rolling out with the doctor. We have the R is how this disease is transmitted. The SARS-CoV virus is transmitted by R, which is respiratory. We know that this virus can live in the environment, in the air for 14 minutes. Folks, there is no social distancing. 3 feet, 6 feet, 9 feet. This virus can go 52 feet. This virus can go a mile. This virus can get up into an air conditioned unit and infect everybody in a nursing home, a hospital, military barracks. It does not have boundaries. The 7 F's that we have, and the 7 F's are face, feces, fingers, flies, food, foot, and formite. So let me give people an example of what a formite is. How do you protect yourself? A formite is your cell phone. It's an inanimate object. It's your coffee cup. It's your credit card. It is the door handle. It's your clothes. It's the bottom of your shoes, or it's your shoes itself. Well, folks, guess what? The science has already proven that this virus, the SARS-CoV virus, can live on inanimate objects for 28 days. So I can cough into my sleeve, I'm infected. That virus can be in my clothes for 28 days. It can be on my cell phone for 28 days. It can be on my ATM card for 28 days. It can be on my money for 28 days. It can be on my shoes for 28 days. Influenza stays for 14 days. Once again, it shows you the significant. Feces. Now, people don't realize that respiratory is very important in the transmission of this disease, but also feces. Folks, the virus lives in feces for 35 days. You can imagine somebody goes to a public bathroom, it goes to the McDonald's, hotels, airport. Somebody's asymptomatic or symptomatic. They use that toilet, they flush that toilet. That virus becomes ultra aerolized. It spreads all over the bathroom. There are no lids in public places and stuff. And then you can imagine that virus can live on that surface for 35 days. So here you are, the person in the airport, and you walk, and that bathroom's contaminated. We've all been there before. You got the COVID, the SARS-CoV virus on the bottom of your shoes, and you take your shoes off, or you go home and you walk in your house, and you're transmitting or carrying that virus on the bottom of your shoes. So these are the different things that we try to educate people on in this new day and age. It's called community education, or what we call situational awareness. We have a term that we use in the military called EDNA, early detection, necessary action. If you understand the situational awareness on how viruses are transmitted, and you can contain and mitigate it, and that's what SRS and what we have done by coming up with technology that can mitigate it, i.e., match that disinfect the bottom of one of the F's is called the foot, your bottom of your shoes. That's very important, understanding stuff like that. Fingers, what do we use to discontaminate people's hands that work? Because we know that soap and water does not kill microorganisms. That's in the bylaws of the World Health Organization. Let me repeat it again. Soap and water do not kill microorganisms. It gets rid of secretions, excretion, debridement. That's why you have to have hand sanitizer that lasts 24 hours. You got to have antiseptic hand wash soap in your bathroom that disinfects and kills the virus, especially in children. This is important that people need to understand that. If you do that, and understanding wearing a mask, I don't care if it's a respiratory mask, N95 mask, it could be a surgical mask, it could be a cloth mask. That mask is the barrier from you from the inside to the external environment. That will save your life. And this one, you asked the first question was, hey, what was some of the misinformation? Don't wear a mask. Well, we can talk about where Herman Cain's at. He's in heaven, didn't wear a mask. Ben Carson didn't wear a mask. He's sick. The people that went to Sturgis in South Dakota talking about their constitutional rights, 200,000 people went back into their communities and killed their mothers and dads. That was in the New York Times just 2 weeks ago. They became super spreaders, and they're not invincible. Not one of us is invincible to a virus. A virus does not recognize, the virus does not see color, barriers. The virus is what it is. It's going to do what it wants to do. So our philosophy, my philosophy, SRS philosophies, if you control the environment, baby, you control the virus.
Wow, this is mind-blowing information, Doc. Listen, I've just got a couple more questions, and we'll turn it over to our audience. But it looks like B may have already beat me to one of my questions, and that is, with the holidays coming up, and we've been locked down for 9-10 months, desperate to see family members. We're right in the holiday season, and it's going to be heartbreaking for us not to be able to get together. And my fear, and I think the fear of most of us, is that people are just going to throw caution to the wind, and then just go see mama, grandmama, and family. What do you say?
Well, let me keep it real. And you know me. I always tell people I can give you the Dr. Rowling version, or I can give you the Mickey Mouse version. This is reality. Nobody's going to listen to any government officials telling them not to go visit their family Thanksgiving. Folks, forget about that. People are going to go visit their family member. People are going to go get their eggnog with their family members, their mama, their grandmothers. People are going to have their cornbread stuffing, their turkey, their potato salad, their cranberry sauce, their sweet potato pie, and potato salad. That is going to happen, period. So what we recommend, that's going to happen Thanksgiving, it's going to happen during Christmas, because what? People are what we have pandemic psychosis. People are fatigued. People don't want to hear about the SARS-CoV virus anymore because, hey, it's negative in their way. But folks, the virus is still here. So I would tell people, and I've talked about it in the Denver Urban Spectrum on questions and answer. People are traveling, go see their family members. Folks, go do it. Dr. Rowland says, make it happen. But before you do that, you better make sure your family members understand the biosafety, biosecurity protocols to protect themselves, i.e., they better have an SRS mat in front of their door to disinfect all their people's shoes. They better have hand sanitizer that disinfects everybody's hands and stuff. They better have antiseptic hand wash in that bathroom, and they better be wearing that mask. And only time they lift that mask up is when they're putting that great Big Mama's cornbread stuffing in their mouth. Folks, you understand the ground game. If you follow Dr. Rowling, SRS, and our protocols and procedures for your home, your family, your businesses, you can function just fine. Absolutely 100%. And I hope some people send me some of their sweet potato pie so I can find out who has the best sweet potato pie in America, north, south, east versus west.
Well, I'm hungry. Well, listen, so we want to give you an opportunity to talk about how our audience might be able to procure your products, because we do want to make sure that our people are safe. And my final question before we jump into the audience questions is this notion being touted about herd immunity. In other words, just let the thing go, and ultimately we're going to become immune to it. It sounds like nonsense. It sounds extremely dangerous, and it sounds like suicide. Can you talk about what this notion of herd immunity is?
Well, let me define what herd immunity to the platform. Herd immunity is a concept where, in theory, you get any immunology book, we have pictures of it, where 90% of a population is exposed to the disease. And then once 90% of the population is exposed to disease, the other 10% of society can come on out, because these 90% of the people have already got antibodies, immunity to it. And so these 10% of the people don't have to worry about it. Well, that's theory. But before you get to 90% herd immunity, can you imagine 360 million people times 90%, 280 million Americans will have to be infected by this disease, this virus. Folks, you know how many people will be dead by the time you get to 90%? It'll be millions. Put it globally, tens of millions of people are going to die. And so herd immunity is an archaic term. And that is why they have this control shutdown where we quarantine people, we establish social distancing to control the virus is burning through the population quickly. And so what the reality is that you shut it down and then you control the virus because the hospital beds are overcome, the system's collapsing because the system will collapse. That is a fact. It's starting to collapse now in such places like South Dakota where people are talking about their constitutional rights. They ain't laughing and joking anymore. This is serious business. So what you do is that you shut down the society in the beginning, like we did in March, April, May, and June. Then you start opening it up, and then people start getting out again, and bam, you get your second wave. And where we're at, we're in the second wave. And then you open up a little bit more, and then the third wave will be the other 25%. So when you start talking about herd immunity, folks, and this is where we're going. This is the reality. It might be this is not science fiction channel. This is not a horror movie. In reality, folks, where we're going, treatment, no treatment, vaccination, 90% of the planet will have to be exposed to this virus one way or the other to get immunity. And what that tells you, folks, this is our new norm. Mask, hand washing, technology, wearing eyeglasses. When I get on airplanes, guess what Dr. Rowland has? I have my glasses like this that I wear on airplanes when I'm in a dense population, because I don't want this virus contracting in my eyeballs.
So I'm going to go to some of our audience questions here, Doc. This is from Ebony. As cases go up, how can providers in the outpatient clinic safely protect patients, themselves, and loved ones at home? And also, is there a benefit to taking Prevnar 13 versus Pneumovax 23?
Well, in my opinion, what I've talked about throughout the last 6 months, when it comes to a vaccine that I would recommend, people are going to take the flu shot because they want to take the flu shot. But I think the most important shot that everybody, a vaccination that people need to have, is a Pneumovax 23, period, end of story. Because what kills you with influenza A or B, or with SARS-CoV virus, and then we know that people are going to have both diseases. This is why the doctors call them, this is going to be a winter of hell, Hell, because people are going to have co-infection. You want to prevent streptococcus pneumonia, so you need to have the Pneumovax 23. That is a baseline, game-changing vaccination that I recommend. And other parts of the world are inoculating their whole entire population with the Pneumovax 23 shot. That is fact.
Okay. She also wants to know about the immunocompromised.
Immunocompromised?
Yes.
The question is that, can they get the shot effectively? Yeah, absolutely, period. When we talk about immunocompromised, they want people to get the flu shot. Immunocompromised people, diabetes, high blood pressure, people that have autoimmune diseases, immunosuppression, absolutely.
So here's a question, I believe from Tanya. What about wheelchair if they're disabled and you have to use a wheelchair daily? What would be your advice to those folks in keeping themselves safe?
Well, this is one of the ways that we talk about how do we protect our society? How do we protect our most vulnerable people, the people that have disabilities, i.e. people that are wheelchair bound? Well, it goes down to, once again, SRS technology. Well, we have many biodecontamination units that people can go through a door, and it disinfects people from the top of their head to the bottom of the shoes. We have many biodecontamination units where people can spray their wheelchairs. We have our study on the SARS-CoV virus on wheelchairs. We found it on canes. We found it on ATM machines, vacuum cleaner handles. So people that are disabled need to be also sprayed or disinfected as an inanimate object. It is a fomite, a big fomite. So you can imagine a patient that is affected or asymptomatic with the SARS-CoV virus, and these people that have disability, someone will soil through their pants, and that fecal matter will get on that wheelchair in the seat, and that becomes a source of infection, just like going to a movie theater.
B wants to know about safe travel over the holidays. Is that even possible?
Absolutely, it's safe if you understand the 7 F's, if you understand the respiratory, the air environment. Absolutely. If you have a good mask, you have the eyewear, you understand the environment, situational awareness on that, you can travel. I travel all over the country. Every week I'm some different place, from Jacksonville, Florida Jackson, Mississippi, to New York City, Denver, Colorado, North Carolina. I'm on planes. But guess what, folks? On these planes, on the buses, on the train, there is no social distancing. It's impossible to be 6 feet from somebody, 3 feet, 9 feet, 12 feet for somebody on an airplane. That's why it's important for you to wear your mask. Make sure you have your mini biodecontamination unit. You can spray your chair down. Because you think about it, they give you alcohol wipes. Alcohol wipes are great. I talk about it in the World Biological Warfare in my laboratories. We use alcohol to disinfect the counter after we're done. But guess what, folks? It only lasts a short time, 70% isopropyl alcohol. But guess what? The surface can be recontaminated again. So you have to have stuff like our biodecontamination spray units, our hypochlorous acid solution, ProGuardium that SRS has, where you can spray, and that lasts 4 or 6 hours and gives you that sterile zone in your space.
Very interesting. Here's a question from Sheila. She wants to know your thoughts about Eli Lilly's antibody treatment.
Well, what that comes down, Eli Lilly, that is about what we call monoclonal antibodies. And what they're trying to do is they base this technology off of trying to inhibit the virus from penetrating the cell. The research is based really off of Ebola. And so what they did, they took the pathogen from human beings that were infected, they injected it into mice. The mice made antibodies, and out of the library they found 4 antibodies that are supposed to inhibit the virus from infecting the individual by blocking its attachment to the cell. Guess what happened with the Ebola patients? Half of them died. Still, even with the antibody. And so what they're talking about is it's a monoclonal antibody. Is supposed to inhibit or attach to the receptor that attaches the spike protein to the cell. But guess what, folks? Viruses, I always ask this question. Do viruses have a conscience? Do viruses think? Because will mutate. They will change. Just like the HIV, when something feels stress and it's about survival, evolution, they always seem to work a way around it, the immunity. So the thing about monoclonal antibodies, well, they better have monoclonal antibodies to every different strains of the SARS-CoV virus on this planet, from China to Africa to Europe to Ireland to Antarctica, South America. They better have a pool with every possible combination that this virus can be, and that's why it's not going to be very effective.
Okay, well, Tanya wants to know, if you have no symptoms, but you are at an event where someone was later found to have COVID-19, should you get tested or simply quarantine?
I think anytime that you're around anybody that's exposed to the virus and you know about it, and that is very important. That's the key, that there's a possibility. So it's a possibility that you can get sick and die. So my recommendation is that if you're around anybody that's exposed to it, you need to contact SRS. We're in every state license in the state. We can come and test you. And the test that we use is PCR, which is polymerase chain reaction, which is the most sensitive test to tell you if you're infected or not infected. With antigen antibodies, there are a lot of false positives and negatives. That is why we have the massive spread of the virus and disease worldwide. Because the test you need to use is polymerase chain reaction, which when we take this by a saliva, that's all, saliva, we will let you know within 90 minutes if you're positive or negative, period. And you come back negative with PCR, you are negative. If you come back positive with PCR, you have the virus. Antigen antibodies is unreliable. Why? Because somebody to really get a good, accurate picture with antibody antigen, you have to be around day 8 to 14. You get infected, well, you're not going to have really signs and symptoms. It takes about 14 days for your bodies to build antigens and antibodies to see it. So if somebody tests you on day 1 of being infected, you're not going to get results. Day 8, you're not going to, you might get a result. Day 5, absolutely not going to get a result. So it's very important when people have antigen antibody tests, they got to test you on day 14. And that's where the variability is. That is why SRS and our PCR technology, we can actually test individuals for the RNA virus. If you're positive, you're positive. That is what you need.
Here's a very interesting question from B again. How about once you're infected the first time, is it possible to become infected 2, 3, or even more times?
Oh, absolutely. And this is why it's a game-changing. This is why it's game-changing technology. See, even with the Pfizer vaccination, they took that vaccination at a time point in the pandemic, or what we call now the endemic infection. Maybe 6 months ago, they got a reference of a virus and they took it and they synthetically modified it and they injected it into cells to make antibodies. Well, folks, guess what? This virus is mutating every 2 weeks. So you can imagine by the time the vaccination is given to the mass population in the world, that virus is not going to be the same virus in March that it was back last February because it's changing. Well, what happens if the mate virus becomes a new viral coming from a new animal model back into us? That is the problem. That is why they're talking about killing all the minks in Amsterdam, the mink farms, because that can be a source of the new pandemic.
Well, I know they call you the Black Dr. Fauci, but I've never heard him keep it this real. Okay, so I tell you, here's a question from James, and he wants to know how he can become a distributor.
Well, this is the brilliancy of SRS and our executive staff, Charles Pickett, myself, James Covington, etc. We knew that we would have big contracts for the federal government. We have them. We have contracts for schools. We are implementing, we do the whole city of Jackson, Mississippi. That's in the newspaper. We've done the school system in North Carolina where kids are going back to school. We brought it down where we have to be able to get this information and the technology to everyday people's hands. And so people can go to srsproducts.com, srsproducts.com, and you can sign up and be your own distributor, your own affiliate, where you can have access to all the technology that we have at a top level down to what we call the ground game, where people can get this to their community. And that's how you can make it happen. That is a reality. That's why we're a dimensional company, very flexible, run by military guys.
Okay.
And we know how to get things done.
Excellent. And so for those who are on the call, B has placed the link in the chat, so you can go to that and find that information along with B's telephone number, and you can reach out to her directly and get all the information that you need.
Hey, Doc, I just wanted to see whether or not there's anything that we missed and anything that you'd like to share. A few more minutes. We've got about 10 more minutes to go.
I think the most important thing is that I think what we talk about is that the way we're going to change this and make a change in mitigating this infection, this pandemic, is that people need to understand there's technology out there, i.e. at SRS, we have the ability, because you can have all the biosafety and biosecurity protocols in the world, we can test a individual facility, i.e. and let people know if the virus is in the building or the facility, the school, the church, the McDonald's within 90 minutes. That's game changing. But I also want to add that as the society is shut down and we start trying to reopen up our society, it's very important that people need to test the water systems for each of these individual establishments, because there's a bacteria called Legionella pneumophila. When the system is shut down and the water pools, this bacterium, gram-negative, grows in the actual water system itself. You turn that water system on, that bacteria gets aerolized, and you get SARS-CoV virus and also Legionella, you got a 95% mortality that you're going to die. So our recommendation is that you have to test the buildings, you have to test the water system, you got to test your sewage system, And you have to actually test people's mask, and you actually have to test individuals. And testing individuals is using PCR, polymerase chain reaction technology, which is the most sensitive. I will also tell people out there that you should have a great Christmas. You should have a great Thanksgiving, but make sure that you implement these fine details I've taught you today about fecal transmission, understanding the F's, understanding the R, that you have access to mats that you can put in front of your house, understanding that this virus can be transmitted by animals, i.e. your dog. So if you take your dog outside and you bring that dog back in the house, you better have a mat that dog can walk across and it disinfects their feet, because that dog jumps on your couch, it can transmit the disease itself. I think people need to understand they need to make sure to get the mini biodecontamination unit where they can disinfect their groceries package, i.e. we found the virus in food, i.e. frozen chicken wings. So you can imagine on the outside of that package, you bring it into your house, you touch your face, you're infected. So when you get home, you need to make sure you spray that meat off on the outside, and then make sure you thoroughly cook that food. You need to make sure that you guys sit down and have a come to Jesus meeting with your children and explain to them about the pandemic, which is endemic. Babies, how do you protect yourself? Why are you wearing a mask? You need to make sure you wash your hands with antiseptic soap. Make sure you don't touch things and put your hands in your face, because you touch your eyes, your mouth, whatever the case is. You touch your nose, because the virus can touch your nose cells and you can contract the virus and stuff. Understanding situational awareness. If you do that, folks, you're going to have a great life. You're going to have a great Thanksgiving. You're going to have a great Christmas. I hope that we can have this sweet potato pie contest and y'all can get some sweet, I can determine who has the best sweet potato pie in America and stuff, and have a good glass of eggnog. You can do that if you understand biosafety, biosecurity protocols, and you listen to people that are trained professionals that have the knowledge. If you're talking to somebody, they don't got a degree in virology, or they haven't done infectious disease training in the jungles of Peru, you better check them, because that information, difference of you living and not living versus the information. And my responsibility is to save people's lives, all people's lives. And I've been doing that for 30 years. My calling from God, carrying people's crosses and stuff, is trust me, the crosses are heavy, but God gave me a strong back. And I got a strong team of SRS to help me carry these crosses and save people's lives.
Speaking of that, Doc, I did get a question from Tanya. She said, based on what you are seeing, when do you think quarantine and the pandemic will end? That'll be our last question for today.
Based off of science and medicine, the quarantine, or when this pandemic, it's not a pandemic anymore, Tanya, it's an endemic. Pandemic means the disease is, this disease is endemic. It means it's in the population. It's not going anywhere. It's going to be like this for the next 50 years. Folks, this disease is going to be strong over the next 2 years. You're looking at 2023 when you start to see some of the light. But your new norm, you will be wearing masks. You will understand bioprotection. You will understand when you go to a Walmart, you're going to understand, I better have that mask on. When I touch that cart, boy, I better have some ProGuardian bio so I can spray that cart down and spray the packages and stuff. Boy, if I get on that airplane and go to the movies, I better spray that seat down, because I can be infected. And so this is a game changing. And what my opinion is that the next 2 years, Tanya, 2023, we're just starting the second wave. The third wave will be in March, maybe April. And then we're going to recycle around one more time. First wave, second wave, third wave. Hey, Dr. Fauci said the same thing. End of 2021, 2022. He's Dr. Fauci, I'm Chief.
You know, with all your remarks, I know Christmas gifts should be a little different this year. And I'm gonna, with the pandemic, the endemic, I think that people need to look at safety protocols and safety procedures. And I have my link in the chat if anyone's interested in getting that mat, because I did purchase one, and I'm gonna probably purchase a couple more for my son. But Christmas should be safe. It should be fun, and it should be with family. But it's important that we protect each other and keep everyone safe. So look at a different way of buying Christmas gifts this year. There's a lot at stake, and we want to save lives. We're right there with Dr. Rowland and Mr. Charles Pickett with SRS. So I hope you have enjoyed this session of Urban Spectrum Now with Rolling with the Doc. And most importantly, we hope it was educational and useful. I'd like to thank our administrator, Tanya Ishikawa, Alfonso Porter, and Dr. Lane Rowling, and all of you for joining us today, wherever you are, if it's on Facebook or just here on the Zoom. If you'd like to send questions to Dr. Rowling for our next issue, email those to editor@urbanspectrum.net or give us a call, 303-292-6446. If you have any questions, and we'll see you soon. Dr. Rowling, last words? Eggnog?
Well, I just want to say, I want to thank you once again, the Denver Urban Spectrum, you, B. Harris, the publisher, my boy, the editor, and Tanya for administrating this thing. And I look forward to our next show in a month. And like we talked about yesterday, this is the type of platform that we have to have every month for at least the next 2 years, because this is the reality that we're dealing with. And when I talked about earlier about community spread of virus, what we have to have is community spread of education and community spread of technology to save people's lives and put it in the hands of people. And like I said earlier, the governments are not going to save you. And like Porter said at the beginning, the government's washed their hands of it. You don't hear them talking about it anymore because they can't fix the problem. Where SRS, System Ready Solution, we have the questions, we have the answers, we have the technology to mitigate, contain this virus, and make people's lives better and save people's lives better. Because I can tell you right now, Thanksgiving, folks, I'm going to have a great glass of eggnog, cornbread stuffing, cranberry, out with my mom, my families and stuff. I'm going to eat good. And I'm going to do that because I understand biosafety, biosecurity protocols, which SRS and all of us developed and stuff like that. So I look forward to seeing everybody again. Thank you for the opportunity. Please send your questions to the Denver Urban Spectrum so I can answer questions and stuff. And the questions are unbelievable. In the last magazine where somebody talked about romance, love, lonely in the times of COVID-19. Mm-hmm. And I told that individual, my reply to that individual is, you can have a great love life as long as you wash your hands and take a shower. And I told that individual, give that person some strawberries and chocolate and let me know what happens.
Thanks, Doc. Fantastic. That's fantastic. We always appreciate you, man. Have a great day.
Thank you.
You guys take care.
Bye-bye.